Tim, hello, good morning, good afternoon, good evening to you all over the world, and welcome to another in our Innovation at Work webinar series from MIT Sloan Executive Education. As you know, we have, in the face of the crisis that we're all very involved in globally, we have really turbocharged this webinar series. We've moved them up to a weekly format, and we've also shortened them to just 30 minutes because we know how much time we're all spending sitting in front of monitors and looking at videos and presentations. So we want to be very efficient today. I'm delighted to be joined for today's webinar by Professor Retsef Levi, who is really one of our very active and distinguished research and teaching professors at the MIT Sloan School. And he's going to be talking with us today about his work related to targeted social distancing. What does it mean for society, and what does it mean for enterprises, which we all work in? You can see here Retsef's bio, which we've shared previously. He really is one of our very active educators in the executive education and our executive degree programs, and we're delighted to have Retsef with us here today. Thank you, Retsef, for joining us.
So thank you, Peter, and thank you everybody for taking time in these busy days to be with us today.
Thank you, Retsef. And today we're going to cover, as Tim said, in a very conversational format, really these two important questions. What is the importance of targeted risk analytics? And we're going to provide some examples, also share with us some of the analytic tools, technologies, and systems that we've learned are going to be essential to not only get through the peak of the crisis, but really to sustain that into the future. So maybe I can launch right into a first question, Retsef, if that's okay with you.
Absolutely, thank you.
Great, thank you. I know you're part of a very large group of faculty and students at MIT Sloan that's called the COVID-19 Policy Alliance that's been working very hard on a variety of issues relative to COVID-19, the outbreak. But can we, before we get into that, take a step back? There's a lot of talk about this outbreak being unprecedented and very challenging. And of course, we're still learning a lot every day about the pandemic, the biology, the epidemiology, and very importantly, the human behavior issues. And there's also a lot we don't know. From your perspective, what is new at the moment? What are the critical things that we've learned so far? And very importantly, what are you concerned about that we still don't know?
Thank you, Peter. So let me actually start by highlighting something that's actually not new about this epidemic. This is another example of what we call a zoonotic disease. These are illnesses, viruses that are transmitted to humans from animals. And this is actually not the first time that as a society we are facing this type of an outbreak. Some more recent examples are SARS, H1N1, swine flu, avian flu. So this is just another example of what is the threat that human health and the health of our societies are threatened by the fact that our economics activities and our food supply chains are interacting with animals. Most of these outbreaks came from food markets. A lot comes from China. So this is just another example of maybe the more fundamental threat that we have on our society that we need to be thinking about. Now, what is new about this outbreak? I think that one of the things that is extremely new is the fact that there is a high level and high frequency of asymptotic patients. Patients that do not observe and do not show any visible symptoms, and that they can be infecting. And in many ways, that breaks the most significant paradigm of infection control or outbreak control, which is typically based on the ability to identify people that are infecting based on their symptoms, isolate them, and in that way makes the epidemic dies. So we don't have that. And that is why, to a large extent, why we are all sitting in, or many of us sitting in our homes under full isolation, because we basically don't have the ability to fully control the outbreak. The second thing that is very, very unique about this outbreak is the fact that it's very, very specific and highly variable about how it affects humans. So most of us, and it could be up to 90% or even more, are not going to be very seriously affected by this virus. In fact, many of us will not have any symptoms, as we just discussed. It's also possible that a lot of us are immune. But there is still a significant enough fraction of people that, for the rest of the talk, I will call them high-risk patients, that are likely to, if exposed to the virus, are likely to get seriously ill, and in particularly need extensive hospital care, and they could also die. And these are, we don't know how to define them precisely, but we have a good sense of what are their characteristics. These are typically older patients, over 65 or 75, and some younger patients that have some background comorbidities like diabetics, obesity, cardiovascular conditions, and others. And the problem is that it's not just about who's going to get sick and who's going to die from this outbreak. You know, of course, any fatality is something sad that we should not take for granted. But frankly speaking, we have as a society people dying from a variety of reasons every day, and we don't stop everything and sit in our homes. The major problem with this outbreak that it can actually, in order to save a lot of people, you actually need a lot of hospital resources that are relatively scarce. And one of the major risks that you can have during this outbreak is the collapse of your hospitals, because they're going to be overwhelmed by a burst of patients that really need a lot of care. And to make things more complex, this could be a very local phenomena. So you can actually have a state or a country that overall is doing fine, but nevertheless, in some certain regions, you can actually have a burst of very vulnerable, or because there are a lot of vulnerable patients in that area, high-risk patients, we call that high-risk patient clusters, areas in which you have a lot of patients that can be seriously affected by the outbreak, by the virus. And if the virus and the outbreak penetrates that high cluster, you can suddenly have a major burst of cases that could crash the hospital systems. And maybe the most visible example is Italy, that its hospital system in the Lombardy region, where the epidemic started, basically collapsed. And now, in that scenario, many other people die, not only from COVID. So maybe that's a good point to get it back to you, Peter. Sorry, Peter, I don't hear you.
Thanks, Retsef. That's a very critical, useful overview of the critical situation here. And of course, you, as I mentioned at the beginning, you've been part of a large group at MIT, the COVID-19 Policy Alliance, that's really been trying to help. So could you tell us more about that? You know, who's involved? What are the aims? How does it work? And are there any examples of any interventions or impacts that this group has had that you could share with us?
Yeah. So thank you. So I need to start by saying how fortunate I am to be part of a very large group of faculty and students at MIT that really came together shortly after the outbreaks started to be present in the US. And together with colleagues at the MIT Sloan School of Management, my colleagues Simon Johnson and Kate Kellogg, we felt that everybody has to do whatever they can to try and contribute to this war. And I really think about it, this is war not against an enemy, this is a war against an invisible virus that not only takes away lives, but also takes away our economy and shut it down. So a lot of people are negatively affected, not only directly by the health consequences, but more the societal and economic consequences of that. So we basically started working, and soon enough, we had a stream of volunteers from our students. We currently have a group of multiple faculty, more faculty joins, like my colleague Vivek Faras and other faculty, and many students joined on a completely voluntarily effort that is typically focused, that is intellectually focused on the concept of high-risk patients. So Again, let me remind people what I mean by that. We are talking about the patients that are more likely to be affected seriously by the virus if they are exposed to it, older people and people with comorbidities. And specifically, we believe that the key to manage this outbreak is to manage high-risk patient clusters. What do I mean by that? Let me just be more specific about that. These are sites or microgeographies that have a high density of vulnerable patients. So let me just give two examples. This could be a senior care facility, like a nursing home, like a long-term, like assisted living home, that has a high concentration of residents that are very sick, very vulnerable for the virus, very old typically. But not only that, they also have a lot of staff members that care for these patients that typically, unfortunately, come also from backgrounds that make them very vulnerable for this virus, right? So that's kind of one example. Another example is some zip code or microgeographies or areas in which the population has characteristics that make it very vulnerable for the virus. And in which case, if the virus or the outbreak penetrates to that area, you're going to have a high level or high numbers of people that will die and people that will need hospital care. So just to make it very concrete, you all know that in Massachusetts, about 60% of the fatalities from COVID at this point are coming from actually nursing home and senior care facilities. And even in Massachusetts, that is a very healthy population in general and relatively young, we have cases like Chelsea, in which the infection rate as well as the number of people that needed hospital care was extremely high. And again, that kind of speaks to the point that the dynamics of this epidemic very much depends on the local conditions, right? Now, how can you take that and translate that to actions and tools? So what we did, we really worked on a range of tools that describe and visualize high-risk sites and microgeographies that are high risk, that predicts based on that where you are likely to have hotspots, and also develop a set of interventions that we all, we put them all under the umbrella of what we call targeted social distancing that try to address these risks. So let me just give an example. Let's just focus for a second on senior care facilities. So we started by collecting data on all the senior care facilities in the US. We were able to draw on data that is publicly available, and by collaborating with industry partners, we were able to also integrate into that data from private sources in order to create a visualization tool that basically allows you at every zip code at the US to see what are the senior care facilities that are in that zip codes, how many beds there are, and what is the risk involved with these facilities based on their past performance with respect to infection control, as well as other factors. So based on that, we did not only visualize that, we actually create a risk tool that provides you risk scores for each one of the facilities and the zip codes. And I'm proud to say that this tool is actually predictive and highly correlated with the number of fatalities that you see across different states and across different zips. So we actually have evidence from the data that's actually very useful to do that. Now, using these, we're actually working currently with multiple states, including Massachusetts, and that is being led by my colleague, Kate Kellogg. So we're working with multiple states, including Massachusetts, with different partners that could be either industry associations or local governments or the National Guard, to develop a playbook of what can you do to actually control the outbreak within these senior care facilities. And the strategy, a strategy has to have at least 4 levels of interventions that are all interrelated. It turns out that the major mechanism to bring outbreak into these facilities are the employees that are coming in and out and going back to the community, bringing back the virus into the facility, and sometimes taking back the virus from the facility to the community. And if you think about that, we are all in social distancing, sitting at homes, but actually these facilities have to continue to operate because someone has to care for these patients. So in spite of the perceived social distancing, these facilities do not have social distancing. And that seems to be the main mechanism of infection. So in order to control that, you need to use aggressive testing. You need to test both the residents and the employees. Unfortunately, even now as we speak, this is very limited in most of the states because of broader problem of lack of testing. The other thing that you need to do is to provide your employees PPE protection that they can care safely for these patients. That's another big problem. Our team was able to arrange for a major purchase of PPEs of the order of close to $3 million to help nursing homes and senior care facilities in Massachusetts. But that's a shortage across the board that these facilities have across the country. And the immediate implications of that is that now you expose the staff members. The staff members often don't want to come to work. And now you have a different problem that you don't have enough staffing to actually operate these facilities safely, specifically when you need to actually cohort your patients to those having COVID or not having COVID. So now the third problem here is that you need to actually help them with workforce. So again, in collaboration with a platform called Monsters, we created an online platform that allows these facilities to recruit substitute staff workforce to actually staff up. And finally, you need to actually have good infection control practices within these facilities. And the problem is that if you try to think about each one of them separately, it's not going to work out because they are all dependent on each other. So we actually developed a playbook that now is being adopted by increasing number of states across the country. And we're gaining increasing visibility because that's becoming an apparent big problem for all the states in the country. So that's kind of one example of a body of work that I think we are currently carrying with our students, with our faculty. I have to say that I'm very proud to be part of that. There's more that we are doing in predicting infections and helping states to think about reopening, but maybe that's a good time for me to stop and let us move to the next question and have an opportunity to talk about this later.
Sure, thank you, Retsef. And I think that was a very good overview of the sort of, as you described, of the playbook and the elements of the system. And while you were talking about those in the context that was maybe local or regional, I'm curious, is that same model basically what we need as states and whole countries are moving to try to reopen? Is that basically the same playbook?
Yeah, so let me maybe share quickly one slide just to illustrate what do we need, what are the elements that we need as we think about reopening to basically get away from the hard trade-offs that we currently have that really puts us in a position when we need to make a choice between shutting down completely the economy versus taking major risks of crashing our hospital systems and causing a lot of fatalities among the most vulnerable patients in our society. So I'm going to share the screen very quickly. Okay, so the whole point that I'm trying to make here is that if we want to actually have a different way to manage this outbreak, we need to put in place a system that has several elements. And unfortunately, the US does not have it at the moment. And I'm saying that especially in the context of anticipating a potential second wave of this outbreak in the spring, in the fall, or in the winter, which in my opinion is likely to be far more challenging than what we've seen so far for various reasons. One, it comes winter, there will be many, many reasons to have fever and coughing and symptoms that are like COVID that can be caused by other illnesses. So that's going to be a major challenge to actually now distinguish and identify COVID patients within this very noisy environment. Secondly, there will be many more reasons why patients will have to be hospitalized. So the load on hospitals is going to be far more significant than even what we saw today. So we're going to be having a very, very significant challenge if this outbreak is coming back in the winter, and we need to be prepared. We have a few months, we have several months to get ready and put in place a system. So what this system needs to have? I think that for reasons related to COVID, but maybe more broadly, this outbreak exposed the lack of what I would call public health intelligence system that can actually monitor and use data to predict and alert in a timely manner on major threats on public health. This could be things like zoonotic diseases and their inception. This could be threats on our food safety, this could be much broader, but in the context of COVID, this should be something that will be very central in actually creating and working with the surveillance system. And I know that when I use that name, that immediately or potentially raises a lot of, thinking what does it mean surveillance system, and how do we think about the surveillance system in a democracy like the US? But I can tell you that in many other democracies at the moment, that's a key element that is being used because it's really key to be able to manage this outbreak. So what these two things are doing, the surveillance system has to essentially be able to test and screen in a very large scale people, including people with no symptom. And this is currently a capability that the US doesn't have because it doesn't have enough testing resources or screening resources. And the idea is to try and identify patients and hotspots, small neighborhoods that seem to have an emerging number of cases, be able to identify the contacts, the people that came in contact with them, and then quarantine them in a much more targeted way than what we do today. The intelligence system also should help us predict and prescribe where do you want to allocate resources very rapidly to actually isolate these patients, right? The second thing that we need to do is to really care about the high-risk patients. We need to make sure that these high-risk patients are taken care of at their homes, protected, not only from a health perspective, but more broadly, wellness, food, prescription drugs, and so forth. We have to keep these patients away from the outbreak. And here telehealth services will be key. We were basically forced for maybe the largest experiments of telehealth systems and services because of this outbreak. It was kind of being done very, very quickly in an unplanned manner. But still, many people in this country do not have access to telehealth services. And it's not just about the technology, it's also about how you staff this telehealth and how do you staff these telehealth systems with the right professionals. And here the national system will probably will have to play a major role to take care of that. And finally, you also need to make sure that we are able to collect the best data we can about what is the potential underlying genetics of this virus, because there is a strong evidence, because of the specificity of its impact, that you might be able to actually predict who is vulnerable and hopefully develop vaccines and therapeutics if you just collected in a systematic way data that helps you to actually understand how this disease works. Now, data is key, and integrating data and creating a data infrastructure is a major enabler of all of this. I think that here we will have to see a joint government industry effort. But I also want to make sure that we understand that at the end of the day, a lot of this depend on public health behaviors and infrastructure that are completely new. So to some extent, the way to fight this outbreak depends on each one of us as individuals. And it really has to do with the notion of solidarity. Because as I said before, most of us probably can just go and live their lives with basically ignoring this virus. Continue to behave the way we behaved, we are probably not going to be affected directly, or at least not immediately. But the risk of doing that will be that we are going to affect many people in our community and in society, and maybe ultimately also harm our hospital systems, which can then have repercussions on everybody. But this is a very I think it's a testing situation for us as a society, because with all the technology, with everything that I talked about, which is all a major enabler, at the end of the day, a major part of being able to fight this will depend on individual behaviors of each one of us. Are we wearing masks? Are we keeping social distancing? Are we being thoughtful about what we are doing? And I think that that's kind of the way I view that, as much as I like data and analytics, that's at the end of the day has to do with human behaviors and with values and culture, and how do we want to act, each one of us individually within our society.
And actually, just following up on that point, I mean, I think this is extremely helpful framework, and clearly a lot of these measures are things that need to be led by, undertaken by, and directed by authorities. But what should we as individuals, particularly those of us who have leadership and management responsibilities, what should we do now, or when can we do something? You know, what are the systems that we need to do? Is it just, you know, the same things that you're describing, or, you know, is there any key data that we should be looking at to help us understand what we need to be doing? And maybe, I know you're involved in sort of thinking about this for universities, for example, as a kind of enterprise. What are the things that, you know, as enterprise leaders, we need to be thinking about?
Yeah, I think that essentially every enterprise in the US and the world will have to think about what the post-COVID world means, especially as long as there is no vaccine and the outbreak does not disappear completely, right? And I think that some of the insights will be specific to COVID, and some of the insight might be more broadly about how organizations should operate. But the most immediate set of questions that, like a place like MIT asks itself, okay, am I bringing back all the students and the faculty back to campus in the coming fall, right? But similarly, other enterprises have campuses, have plants, have offices, and how to think about it, that's not clear, right? It's not obvious. There is a set of questions and a set of capabilities that enterprises will have to sort of think about. Let me start with what might be operational imperatives or goals in order to be able to sort of think about how the solution should look like. So the first issue, you will have to be compliant with local regulations, and they might change from country to country, state to state, and potentially based on the dynamic situation of the outbreak. The second thing is you will need to think about how do you actually design your processes and work processes to make sure that you maximize social distancing and keep social distance. That may include scheduling of shifts that's going to be different, other things, space design, adding sensors in your workplace, and so forth. But it's also very clear that you will need to have some engagement with your employees about behaviors in the workplace, but also being able to test them aggressively if you think that there is some outbreak starting to spread in your workplace. So companies will have to think about what is their testing strategy, how do they get access to resources, how do they actually create a command center that allows them to manage this dynamically. And for many of these companies, this is not something that they currently have. So it's going to be interesting to see how companies evolve and think about this clearly and learn from each other. I think that one of the things that we are starting here at MIT is actually creating forums in which companies can actually share best practices and hopefully accelerate the learning around that.
Thank you. I think that this is a topic we could talk about for many hours, but unfortunately we're very nearly out of time. But just maybe I could turn in closing to sort of a more personal question to you, Retsef, which, you know, this is a challenging time. We're talking very much in technical solutions in many ways here, but you touched on the question that this is very human tragedy as well. So, you know, do you have any tips or advice on how we can try to avoid being paralyzed, or alternatively making decisions that are too hasty and that, you know, get us into trouble as well?
Yeah, I mean, I think that you know, you can easily get disturbed and put down by what we've observed in the US. We definitely did not perform very well as a country so far compared to other countries. At the same time, if you look historically, the way the US is built is making it relatively slow to react initially, but at some point the coins everything falls in the right place, and the country as a whole is starting to move in the right direction. I think that the encouraging thing is that still the US has some of the best, most advanced companies in terms of operations, analytics, and overall system thinking, and the ability to really come up with creative solutions. So I'm very optimistic that if we get together and collaborate around that, both as individuals as well as companies, we will be able quickly to not only catch up with this virus, but maybe be in the natural places I would expect the US to be at the forefront of the innovation and cutting edge approaches and technologies and solutions to manage not only COVID, but also things like COVID in the future. So I'm hopeful, and I think it will depend on creating the right ecosystems between private sector, academia, and government, bringing all the brilliant brains that we have in this country to think together about what does it mean to us and how are we working to bring this country to where it should be. I'm hopeful and I'm very optimistic that this is doable.
So at the same time as we have to continue to socially distance physically, I'm hearing you say we have to be careful not to socially distance sort of emotionally, or how we collaborate, and that we're closer, in fact, than ever before in terms of our shared needs here and how we need to work together in the response.
Yeah, and I have to say, I've been seeing that for many companies and individuals, the willingness to give, the willingness to share data that under usual circumstances will not be shared. I see that in our interactions with companies and individuals, the willingness to give, the voluntary, you know, a lot of volunteers, people are willing to volunteer their time, their effort in a very humble way. So this was a very humbling experience for me and rewarding experience to me to see the power of this. And that's why I'm still optimistic that in spite of the bad start, the rough start that we had as a country, we have a path forward.
Thank you. I think that's a very optimistic note to end on in what we all understand is a very challenging situation. Thank you, Retsef Levi, for all that you and all of your colleagues are doing to be really a proactive part of the solution and taking us forward positively through these challenges. Really appreciate you taking the time to spend it with us and all of our community here at MIT Sloan Executive Education. And it just remains for me to say goodbye to everybody. Thank you once again, Professor Retsef Levi. This has been fascinating and I hope very useful to all of the people listening in.
Thank you, everybody. I hope everybody stays safe and healthy.